about the Ayurvedic system of medicine. So, first of all, I am discussing about what is Ayurveda. Ayurveda, it is literally composed of two words. One is Ayu, that is mean the life, and another one is the Veda, that is mean the knowledge, and it is comprised with Ayurveda. So, together, the knowledge of life is the literal meaning of Ayurveda, and its mention is there in our traditional texts like Atharveda and Yajurveda. If you look at those texts, the mention of Ayurveda is there, that is around 5,000 years ago. So, mention of Ayurveda has been seen in our Vedas since 5,000 years. So, this is one of the oldest system of medicine. I can say until date, it has been sustaining itself in terms of its different medicines and treatment systems, because of which it becomes one of the most important type of traditional system of medicine, which needs to be studied in detail. And being a pharmacist, because many of the people with when they have to take long term medicines, they start drifting towards the traditional systems, because it is a type of, you can say, concept has been there. People have a mindset that the Ayurvedic medicine do not have side effects, though it is not true. However, because the Ayurvedic formulation, they are mixture of many ingredients, the side effects reduce. So, because of which people start taking Ayurvedic medicines if they are not getting any kind of help from allopathic system of medicine. Now, if we go at the basic principle of Ayurveda, we will discuss that in brief. So, Ayurveda says that the entire universe, that is macrocosm, as well as the individual or the body, that is the microcosm, both are made up of five things which are known as Panchatatvas, or that is also known as the Panchabhutas. So, what are these? They are basically consisting of the Akasam, okay, Akas or the sky. You have the fire, that is the basically bringing about a lot of, I can say, heat along with it. We have a gel or water, then we have the earth, that is the soil. The earth is the hard part of our whole entire universe, that is the earth. And finally we have the air or the space, which is there, it is also known as the ether. So these five things, sky, fire, water, earth, and air, together form Panchatatvas, and they are present in the universe as well as in the individuals. Now, we have studies in anatomy and physiology regarding the sympathetic and parasympathetic systems. We know that sympathetic system increases blood pressure and parasympathetic system decreases blood pressure. So, in short, it is maintaining the blood pressure. So, different things like heart rate, digestive system, all this is getting maintained by both the systems. Now, here this is concept of sympathetic and parasympathetic in Ayurveda is changed to three parts, that is Vata, Pitta, and Kapha, as the three, you can say, areas in the body, and they have a specific property. Vata has a different property, Pitta has a different property, and Kapha also has a different property, and its present in the body is also varied. Now these three together are known as the three doshas or the humors, and these three doshas, they are made up of the Panchatatvas only. So, Vata, it is made up of air and space. Pitta, it is made up of fire and water. And Kapha, it is also made up of water and earth. I move towards Ayurveda. they say there are different dhatus which are known as the dhatus or substances in our body. They are basically rasa, which means plasma, rakta, which leads to blood or RBC, mangsa, which means muscle, meda, which leads to adipose tissue, asthi denotes bone and cartilage, majja means nerve, and sukra means reproductive system. So we have these sapta dhatus or seven dhatus which are present in our body. Now we are eating food for having energy and working. We have all things going on in a healthy pattern. But humans, other than this, whatever raw material is taking in, whatever food we are taking in, it gets excreted also. So, whatever material is excreted, they are known as malas in Ayurveda. They are generally mudra chakrit and sodana. That is the excretion to the urinary route through the fecal material as well as through perspiration. Now we go to the diagnosis in Ayurveda. So the method of diagnosis in Ayurveda is known as Asthasthana Pariksha, which is also known as 8-point diagnosis, where we perform the Nari Pariksha, this is pulse diagnosis, Mutra Pariksha, this is urine examination, Vata or Sparsa, which means nervous system assessment, Pitta or drink, which leads to assessment of digestive fire and other metabolic secretions, Kapha or Akriti, which denotes mucus and mucoid secretion assessment, Mala Pariksha, that means stool examination, Jiva Pariksha, which leads to tongue examination, Sabda Pariksha, which is examination of body sounds like stethoscope, which is used to understand the heart rate. It is a modern medicine type of instrument which tell us whether our heart rate is working properly or not. So, you have heard about ultrasound in modern medicine. What is it? It is also understanding the sounds produced in the body. So this concept of ultrasound is not new. It is there in Ayurveda, also in the form of Sabda Pariksha. Whether our body is making any kind of sound or problem, then that is ascertained as one of the diagnostic points. So this is the Asthasthana Pariksha or 8-point diagnosis. Then we come to the treatment. Treatment in Ayurveda is divided into three parts. First one is the Sodhana, second one is the Samana, and third one is the Rasayana. First of all, I am discussing about the Sodhana. Sodhana, which also means cleansing, where a person is getting purified. It is the process of toxins in the body are getting removed. The toxin also emotional. They can be eliminated through meditation, through yoga, or through counseling. Then second one is the samana. Samana is also known as the palliative treatment. It reduces the intensity of a disease and balances the disordered doshas. So this is basically, I would say, the symptomatic treatment. If a person is suffering from any kind of headache, so we are just treating the headache here. Or if he starts suffering from stomachache, so we are treating the stomachache. So that is the samana treatment. Third one is the rasayana, which is also known as the rejuvenation therapy. Means that here the person seen Ayurveda having no disease. It is used to maintain health and reduce the negative effect of the disease. Most important and common rejuvenator drug is the ashwagandha. Now we come to the pharmacist point of view, and now we are discussing like a pharmacist in Ayurveda. So we know that how the disease is diagnosed in Ayurveda, how it is treated. But while treating, what are the things which have to kept in mind? So, first thing, that a doctor in Ayurveda, he always considers a patient as an individual. It's not like allopathic medicine. We have to give antiviral drug, and we know acyclovir is an antiviral drug. We will give the drug. It's not like that. Here, the person has to be analyzed. His nature has to be determined. Which kind of tridosha is there in his body, and as per them, the individualistic treatment is done. When the treatment is done, we have the treatment either by meditation, enema, etc. Those things are there. That is pancha karma. But after that, we have to give contents certain drugs to them, and these drugs also carry certain properties in terms of three dosa, that is Vata, Pitta, Kapha. Why? Because they are also the part of universe, and they are also made up of panchatattva. So they will also have the three dosas, and based on 5 points, that is, first of all, rasa, which leads to taste; guna, which means physicochemical properties; virya, which means potency; vipaka leads to post digestive effect; prabhava means unique effect of the drug. So these are the 5 points based on which all the Ayurvedic medicines are analyzed. And based on that, Ayurvedic practitioner knows this is the guna, rasa, virya, vipaka, prabhava of our drug. So this drug can be given to a patient for its treatment.